Good afternoon, Governor.
Good afternoon.
And to everyone at home, we begin with this question. Progressive groups say that low-wage workers are keeping the state afloat and deserve a living wage, especially low-wage workers who are continuing to work in an ever more dangerous environment. Your thoughts?
So, a few thoughts. First of all, the sad reality of this crisis is that it's low-wage workers who are being hit the hardest. If you look at who's been laid off in the largest numbers, it's lower wage individuals. And those are the people who can least afford it, which is why we're working so hard to provide, quickly get unemployment insurance out there. It's why I fought so hard to make sure that the new stimulus bill included unemployment insurance for small business owners and independent contractors. Of course, I've always supported a living wage. Before the crisis, I'm an advocate for increasing minimum wage and having a livable wage, and we're doing everything we can. For those of you who are presumably maybe they're asking about healthcare workers, they are absolutely on the front lines, and yesterday, Dr. Nicole Alexander-Scott gave guidance that they should all be wearing surgical masks every day when they go to work, and it's why we're working so hard to get the necessary masks and gloves and respirators so that those folks who have to go to work and for whom we're very grateful that they go to work, we're doing everything we can to protect you, and we're going to continue to do that.
You mentioned earlier, and the question is, why does the federal government cancel some orders of PPE? Is it being diverted to other areas like New York?
Yeah, excellent question, and it gives me an opportunity to share the reality of what we're dealing with. So 2 weeks ago, President Trump said, somewhat famously, he doesn't want to be a shipping clerk, and gave clear direction that the governors we were the front lines. The federal government would support us, and they have done that, and Director Gaynor has been excellent in supporting us with access to the national stockpile, but in the first instance, we're on our own, which means I begin every day on the phone with diagnostic companies, manufacturers in China, doing everything I can with the team to purchase our supplies. At the same time, every other governor is doing the same thing, and the federal government is in the market. So it's literally a globe, and 142 other countries who are dealing with corona are also in the market. So the short answer to Brian's question is yes. At the same time, I might be lining up an order with a diagnostic company. FEMA is in the market making a much larger purchase for the federal government, and then shifting that maybe to New York City, maybe to New Orleans, maybe some to Rhode Island. But it is a very opaque system, to say the least. And so what that means, the direction I've given my team, is you can't let up. Even when we think we're in good shape, you have to go order more. And by the way, earlier today I was on a phone call, and governors are seeing this in every state. So we're just going to continue to do what we can do. And the only good news is that FEMA says that a lot of what they're purchasing, they're going to start pushing into the private market. So hopefully there'll be more availability in the days and weeks to come.
Governor, could you explain why we don't hear about numbers of recovered people? Is there a reason why that number isn't mentioned?
Would you like to take that?
I'd love to. Yeah. So thank you, Governor. So I think like a lot of departments of health in the United States and across the world, we're really focusing on identifying cases and then doing contact tracing. The vast majority of people with COVID-19 do get better, so 85 to 90% recover, rather uneventfully. It's a mild illness. It's so mild, quite frankly, that some people don't even know they have it. We do keep track of people, though. Like I can tell you right now, although there's 60 people in the hospital, 33 have been discharged. So we are keeping track of it, though, but we just haven't been talking about it. We're focusing on what we think right now is most important, is identifying the cases, doing the contact tracing, and then getting the appropriate people into quarantine. Thank you.
Thank you, Dr. McDonald. The next question is, what is being done to ensure that essential and state workers are being kept safe and following guidelines like spacing out employees and in groups of 5 or less? Are spot checks being done here as well?
Great, thanks. Yes, again, I've said it every time I've had a chance to be up here, we're really grateful for the state employees who are providing essential services, whether they're Dr. McDonald's colleagues at the Department of Health or the folks on the phone at the Department of Labor and Training processing your unemployment claim, or on a busy day like today, the people at the Department of Human Services that are ensuring that essential benefits get out to Rhode Islanders most in need. We're working closely with every department to make sure that we can do things like social distancing and enable remote work wherever possible. We have nearly 2,000 state employees who are now teleworking, which is not something 3 weeks ago we would have been able to say we could do, but this challenge, this crisis has pushed us to try new things. We're particularly grateful for our partners in organized labor, all the unions who are representing state workers who have given us extra flexibility and allowed us to work with them. And so we're doing things like split shifts. For example, the folks at the DMV who are still seeing Rhode Islanders by appointment only. There's 2 groups, and so the teams rotate so that we can enable better social distancing to make sure that that group isn't in the same building at the same time. And so we're trying a variety of innovative strategies. State government is not always known to be flexible and innovative, but we're working hard, and we wouldn't be able to do it without our partnership in the unions. And we're doing our best to make sure that we can continue to provide these essential services, but to do it safely and to keep our workforce safe in the process.
Thank you. Dr. McDonald, despite hearing that many people have recovered, our viewers are pressing us for hard numbers. Can the Rhode Island Department of Health estimate the number of recoveries or perhaps the number of active COVID-19 cases?
Yeah, so I get why you're curious. So we do have the 566 cases that we know about, but we actually know that there's many more people, only some more people, who've had COVID-19 who haven't been tested, and that's not expected. In other words, we know some people have a mild course of it and get better. We have every reason to believe that well over 90% are recovering quite quickly and doing quite well with it. So I just think that's a context setter for this. You know, just keep in mind, too, as far as context goes, we are on day 32 since our first patient, and it's really only the 13th week since this world has even known about this disease. So we're really focusing on what we believe to be the most important thing, which is identifying the cases. And that's why I'm excited about the testing that's going on. We've really done a lot to ramp up the testing, and you're going to see more testing starting tomorrow. And as we get more testing done, we are going to identify more cases. And I think that's going to be very helpful as we get more people identified, more people quarantined, and I think it'll help us get ahead of this. Thank you.
Governor, does the state have any plans to implement digital contact tracing using mobile phones? If so, please describe how this would work.
Yes, so as I said, right now we have a technology team looking at all the different ways that we could leverage existing technology to do better contact tracing and symptom tracking. The answer is there will be use of a mobile phone, definitely. We are attempting to weave together different off-the-shelf technology. So maybe we might use Salesforce for a certain piece of it, another telemedicine application for another piece of it. So it's premature for me to say that we have a solution today that I can roll out to you. But as I said, I hope that a week from now I'll have much more to announce, and we will have mobile apps for people to frankly do everything. You know, we're trying to get everybody to stay at home. So we're trying to move everything we can to mobile phones as it relates to telehealth, ordering appointments, tracking symptoms, tracking quarantine, etc. So just hang on a little longer and I'll be able to make some announcements with some details.
The next question asks, many workers at Electric Boat and Quonset and on construction sites are worried they are not social distancing, and if they complain, they will lose their job. Can anything be done?
Absolutely. So hearing this, I will now call down to Electric Boat. You know, we are doing everything. That's not okay. You should not be required by your employer to be in close contact with anyone. And we are going to do everything we can to clamp down on employers who are not following the directions around social distancing. So if you are worried about it, call us. Send me an email. Send an email to the governor's office. We get plenty of emails every day. I will look at it and I will do my best. Call the Department of Business Regulation. Don't call the Department of Labor and Training because they're busy processing unemployment claims. But call me. call DBR, call 521-HELP. It's not okay. You should not have to work in those working conditions, and the more I hear about it, the more I can try to do something about it.
The next question is about the small business loans that you just announced. What about businesses with more than 10 employees? Many say they can't pay their rent today because of the closures.
Yes, I understand that. So, as I said, I've called 521-HELP, and we'll see what we can do. I'm sure you've already called your bank, but if you haven't, obviously do that. We're working with banks to ask them to be lenient. We set up a special arrangement yesterday with the Superior Court. So to help you work through this situation, you can call the Superior Court. Call the SBA. The SBA loan program is for all small businesses, not just 10 or fewer. And every day I'm trying to come up with new solutions, so just stay tuned right here, and we're going to do everything we can to get some more money out as fast as possible. Soon enough, the federal money from the stimulus will be on the street, and we'll be pushing that out to you. So just hang in there if you can a little bit longer. Call 521-HELP if you really can't make it, and we'll do our best to help you out one at a time.
Governor, what is the state doing to mitigate the negative impact of the coronavirus crisis in the census, especially in hard-to-reach communities?
So we are increasing our advertising and outreach to those communities through this time, and the federal government also is providing additional resources for that. So the answer is we're going to spend more money, and we're going to work harder, and we're going to try to message through the coronavirus.
In addition to CCRI, URI, RIC, Kent Hospital, and Rhode Island Hospital, where else in Rhode Island can people go to be tested for the COVID-19? If those are the only 5 sites right now, are additional locations being looked at, and if so, how many?
So let me say this. You should not be going to those sites at all unless you have an appointment. So if you feel sick, you should pick up the phone and call your primary care physician. And then talk to the physician and decide if you should be tested. If you should be tested, your primary care physician will get you an appointment at the appropriate center in order to get a test. If you don't have a primary care physician, call an urgent care center. If you don't want to or can't do that, call the Department of Health's hotline. At this point in time, as I said, starting tomorrow, we have the ability to swab and test 1,000 people a day. These are by appointment only. If you just show up or if you drive through, you will not be served. So the message to primary care providers is start sending us your patients. The message to the people of Rhode Island is get in touch with your primary care provider and we'll get you a test if a test is warranted.
Was the president on today's call with the governors, and if so, what was discussed?
No, today's call was hosted by the National Governors Association, and it was a meeting of just the governors, and it was really just an opportunity for us to share good ideas, what's working in different places, and also collate and put together our shared concerns so that we can together as governors, in a bipartisan way, advocate to President Trump and the Congress for what we think we need to fight corona in each of our states.
Next question is about these press briefings. The White House, Governor Baker, and Governor Cuomo all have reporters at their daily briefings. Why not have 10 reporters attend, sitting 10 feet away from each other?
Because that would violate my own order, and I am in the business of following the rules.
And the next question, can you clarify your orders regarding beaches and parks? Some confusion yesterday when you said parking lots were closed. Also, if parks and beaches are closing, why wait until Friday? Why not do it immediately?
Yes. So we are closing the parking lots. So the beaches and the parks will be officially closed. There will be barriers there. You won't be able to park your car. We're asking you not to park your car, and there'll be barriers at the entrances. So we're trying to make it hard for you to access the beaches. Having said that, if you're in a position that you can walk there and you want to go for a walk, then that's fine. We wanted to wait until Friday because it takes a little bit of effort to get the barriers up, get organized, and DEM asked for a bit of time to get organized and also to let people, make their plans. The whole point of this, by the way, isn't to prevent people from going outside. In fact, I'm encouraging people to find ways to exercise, find ways to get fresh air, find ways to get a little vitamin D from the sun, but don't do it in big groups. So the point of this is, if you can go to the beach or a park for a walk with a friend or two or your kids, fine. But we were seeing too many people bunched up, crowds of 5, 10, 15 people in close proximity, and so we felt it was the right thing to do to just shut it down.
The next question brings us full circle to the first question. Would you be willing to make an emergency funding request through Commerce RI to increase the hourly wages of CNA workers in nursing homes, hospitals, and the home health agencies?
So at this time, what we are doing is I'm in very good contact with the hospitals, nursing homes, and the labor unions that represent CNEs and nurses and social workers. Soon, the federal stimulus money will be made available to hospitals and other healthcare providers. And then at that point, I would say that the individual institutions, healthcare institutions, will have to figure out how to use that additional capital to keep the lights on and keep folks employed and to have the PPE necessary. And I would just encourage each institution to do what they think is in the best interest of their employees and their patients.
And our last question for this Wednesday briefing, can you explain why, in your view, in terms of their role in controlling fiscal elements of the state and hospital infrastructure, it isn't necessary for the General Assembly to meet virtually right now?
Because right now, we are not in a position, we pass the budget typically in the end of June, and we're going to have to get to the business of doing that. But at the moment, on April 1st, we're still in crisis management mode. And so, and we couldn't convene to pass a budget right now. There's way too much uncertainty. We'll know a lot more, after April 15th, how many people pay their taxes, after we get the final details of the expenses for COVID and how much will be paid for by the federal government, frankly, what the shape of the curve looks like. So for the next 30, 60 days, we have to manage the crisis, keep people safe, and ready the infrastructure of our healthcare system. Then we will get to the business of seeing what laws need to be passed, how do we deal with the budget, and at that time, I'll figure out with the General Assembly what's the best, safest way for them to do their business.
Thank you, Governor.
Thank you.